Good day, everyone. I will be presenting to you about self-concept. I am Glenda P. De Vera, one of your college faculty for Fundamentals of Nursing. Self-concept is an individual's view of self. It is subjective and involves a complex mixture of perception about oneself, directly affecting the self-esteem or how one feels about oneself. Although these two terms often are used interchangeably, nurses need to differentiate the two so they can correctly and completely assess a patient and develop an individualized plan of care. On the basis of the patient's needs, patients face a variety of health problems that threaten their self-concept and self-esteem. The loss of bodily function, decline in activity, tolerance, and difficulty in managing a chronic illness are examples of situations that changes a patient's self-concept. You will help a patient adjust to alterations in self-concept and strengthen components of self-concept to promote successful coping and positive health outcomes. What are the learning objectives for this? Discuss factors that influence the component of self-concept. Identify stressors that affect self-concept and self-esteem. Describe the component of self-concept as related to the psychosocial and cognitive developmental stages. Discuss evidence-based practices applicable for identity, confusion, disturbed body image, low self-esteem, and role conflict. What are the factors that influence the development of self-concept? Development of self-concept is a lifelong process. Self-concept developmental task according to Erickson's psychosocial theory. Learn to recognize an individual's failure to achieve an age-appropriate developmental stage or his or her regression to an earlier stage in a period of crisis. Each stage builds on tasks of the previous stages, according to Erickson. Successful mastery leads to a sense of self. Self-concept then is always changing and is based on the following: a sense of competency, perceived reactions of others to one's body, ongoing perception and interpretation of the thoughts and feelings of others, personal and professional relationship, academic and employment-related identity, personality characteristics that affect self-expectations, perceptions of events that have an impact on self, and the mastery of prior and new experiences which affects their cultural identity. Self-esteem is usually highest in childhood, fluctuates during adolescence, rises gradually throughout adulthood, either diminished or increases again in old age, depending on self-concept clarity. Erickson emphasizes on the generativity stage that explains the rise in self-esteem and self-concept in adulthood. The individual focuses on being increasingly productive and creative at work while at the same time promoting and guiding the next generation. When aging is associated with deterioration of health, nursing intervention must focus on health behavior that changes to promote self-care and self-concept. Adolescents' participation in group activities can also foster self-esteem. As what has been shown in the picture, you can easily identify yourself. Self-concept is being oneself or living in an authentic life, the basis of true identity. Relationships with parents, teachers, and peers have unique and combined effects on young children's general academic and social self-concept. The achievement of identity is necessary for intimate relationships because individuals express identity in relationship with others. There are components and interrelated terms that is associated with self-concept. Number one is identity. It is an internal sense of individuality, wholeness, and consistency of a person over time. It is a question of who am I? An individual first identity with parenting figures and later out with other role models such as teachers or peers. Relationship with parents, teachers, and peers have unique and combined effects on young child. It is associated now the achievement of identity in terms of intimate relationship because individuals express identity in relationship with others. Cultural differences also exist in identity in which it is an important aspect in self-concept. Body image is also the second one. It involves attitudes related to physical appearance, structure, or function. Feelings about body image include those related to sexuality, femininity, and masculinity, youthfulness, health, and strength. Be aware that most men and women experience some degree of dissatisfaction with their bodies, which affects body image and overall self-concept. Cognitive growth and physical development also affect body image. Normal development changes, such as puberty and aging, have a more apparent effect on body image than on other aspects of self-concept. Hormonal changes during adolescence influence body image. Cultural and associated social attitudes and values influence body image. Culture and society dictates the accepted norms of body image and influence one's attitudes. Role performance. This refers to the set of expected behaviors that are determined by familial, cultural, and social roles. Individuals fulfill several roles simultaneously with parents, siblings, friends, spouse, and student nurses. Each role has a set of expected behaviors. Role performance is the way in which individuals perceive their ability to carry out significant roles. Fulfillment of role expectations leads to an enhanced sense of self. Difficulty or failure to meet role expectations lead to deficits and often contribute to decreased self-esteem or altered self-concept. The fourth one is self-esteem. Why self-esteem is important? Self-esteem is important because it can affect your mental health, how you behave, your decisions, your friendship, your success is your life. Self-esteem is an individual's overall feeling of self-worth or the emotional appraisal of self-concept. It is the most fundamental self-evaluation because it represents the overall judgment of personal worth or value. Self-esteem is positive when one feels capable, worthwhile, and competent. Considering the relationship between a person's actual self-concept and his or her ideal self enhances understanding of that person's self-esteem. The word I cannot is very important in establishing your self-esteem. You just cannot say I cannot because you are shy or you are afraid to do. I cannot is something that you cannot do. You can always do things with your right mind and right perspective. Low self-esteem has its own cycle. Low self-esteem develops negative thoughts. It would lead to high anxiety and poor performance, leads to failure, and therefore it would lead to self-blame, and then it would follow again for a low self-esteem. So the vicious cycle is something that we do not want to develop from each person. Therefore, you need to develop a sense of self-esteem, a high sense of well-being. Build your own self-esteem. What are the factors that would influence the self-concept? Changes that occur in physical, spiritual, emotional, sexual, familial, and social-cultural health affect self-concept. There's change in health and other crises. So these are the influences to self-concept. You consider age, appearances, gender, culture, emotional maturity, education, relationship, sexual orientation, and life experiences. So these are the several factors that would help you develop your own self-concept. Also, again, it has been described that in terms of development of your self-concept, it is described through your body image, identity, and role performance. Family effect on self-concept development is also shown in how the children or the person behaves. This is another picture on how family affects self-concept development. What is the role of nurses now? The role of nurse need to remain aware of their own feelings, ideas, values, expectations, and judgment. They can use a positive and a matter-of-fact approach when handling person. They should also build a trusting relationship, and also they should be aware of their facial and body expressions. So stress and coping, how do we describe it now? Stress and stressors are usually associated with the development of self-concept. Stress is a physical and mental response to a challenging or threatening situation. Stressor is a stressful stimulus, a condition demanding adaptation. Stressor is always a stimulus that describes about the stress of the person. So there are adaptations to stress in which we have to understand. The sympathetic nervous system prepares the body for flight or fight response that allow the humans the best chance of survival. The body's parasympathetic nervous system also returns to normal after the stressor has been removed. It has been emphasized by Hans Selye's general adaptation syndrome theory that proposes the 4 stages involved in adapting to stress. Number 1 is the alarm. The second is fight or flight response. Third is exhaustion. And fourth is return to normal. The alarm phase begins when the body perceives the stress and be aware of it. Then it is followed by your fight or flight response in which your sympathetic nervous system is being activated and prepares the body for fight and flight response. Either you approach the stressor or you tend to get rid of that stressor. So the flight response is also one of your possible response. From that, you would realize that there is exhaustion wherein the body becomes exhausted by its response to stress. And then the parasympathetic nervous system now is activated and then allow your body to return to normal. It's how you approach the stress, either you fight or flight for it, but remember that your body always adapts to being tired or being fatigued. But also be happy because your parasympathetic would always allow you to know to return to its normal state, even if you try to avoid the stressor. Stress and illness is always associated. So it is the general adaptation syndrome according to Selye, in which it describes the body's adaptive response to stress in 3 stages. So this has been mentioned a while ago that your body tends to adapt to the different stresses or stressors that come in your way. Either there is an alarm reaction, you need to mobilize your resources. However, your body also needs to approach or get rid of the stressors. However, in all those approaches, the fight or flight response, the body tends also to have this exhaustion stage wherein your energy or reserves are depleted. The general adaptation syndrome in which it described the ability of the body to approach it. The alarm reaction is the sudden activation of the sympathetic nervous system. Either you fight or flight for it. You get ready now for the phase 2. For the phase 2, it is also called as your resistance. You face the challenge in which you recognize that there is body temperature, blood pressure, and respiratory high tends to remain high. You can either wear oneself out of if maintained for too long. The phase 3 now involves your exhaustion. You are more vulnerable to illness, collapse, or even death. That's why you don't want it to affect you as much as possible. So that's all in terms of how you manage your self-concept. It is usually associated on how we respond to every situations that comes in your life. So stress and stressor are part also of overcoming it. How you develop yourself, your self-esteem, your self-concept is also determined by how you could approach the different stressors in every situation. So that's all. Thank you and be safe, everyone.